welcome back. Well, June is Men's Health Month, and we are joined now by Christopher O'Connell from Northern Light Health Primary Care. Thanks so much for joining us.
Thank you for having me.
Yeah, staying cool out there from the heat.
Trying
Pretty
to.
brutal.
Wow, it is hot.
It is. All right, so we're talking about Men's Health Month, raising awareness about some of the health concerns that men face. To get started, what are some of the most common health issues that men should be aware of?
Well, when you look at men, the number one causes of mortality in all ages typically are heart disease and cancers. The number third cause is unintentional injury, and it's that's the number one cause under the age of 45. But over 45, it's specifically heart disease and cancers. And so when we look at what can we do to have good health and prevent our worsening health, it's really looking for risk factors that are involved in heart disease or evaluating for risk factors in cancer. So when you meet with your doctor, they're probably going to talk to you a lot about what's their family history like, what kind of habits do you have daily, and we evaluate things like smoking history, unhealthy alcohol use, family histories of certain cancers or heart disease or diabetes, and we usually come up with a plan on what can we do to screen for these things and help identify them and hopefully prevent some of these really severe complications in the future if not identified.
Obviously, we're all so busy, men in particular. Yes. Sometimes we tend to put things off. So first off, what can men do to improve their overall health? And when they do visit their doctor, what are some questions that they should be asking?
Yeah, and I know the doctor will probably tell you it's kind of like a broken record, but they'll ask you, what have you been eating? What's your exercise regimen like? Because diet and exercise is really the key building blocks in a lot of good, healthy choices and good health moving forward. So a lot of the times they'll ask, like how much exercise should I have each week? What counts as good exercise? So when I talk to patients, I usually let them know that I usually follow the American College of Cardiology recommendations of 150 minutes of cardiovascular exercise per week. And how that's defined is really having exercise that's able to achieve a heart rate up over 100 beats per minute. And sometimes a brisk walk can do that. Sometimes you do need to do a little bit more aerobic exercise to achieve that. And then we have longer conversations about diet because, how many calories should I be taking in? What kind of calories? I talk a lot about Mediterranean diets because there's some data behind that in reducing unhealthy cholesterol levels and improving cardiovascular health. So we have those kinds of conversations. We talk about limiting things like complex carbohydrates that can put you at risk for insulin resistance and things like complex carbohydrates, things like pastas, breads, starch vegetables like potatoes, pretty much a lot of the things that taste good, unfortunately. So we have those, difficult conversations on, everything in moderation and what we can do to kind of have a good diet.
Talking about exercise, what are some tips you have for men to stay accountable?
Yeah. I think we all get into these fads and these, goals of having this exercise program, and usually we start off pretty consistent with it, but over time, like most things, they kind of fall to the back burner. So I usually try to be realistic with patients and say, what can you do each day that might be able to achieve some of these exercise goals? And it might just be a walk after dinner with their family, walking their dog. It might be, I could take the steps, I could take the stairs going up to work. I don't have to take the elevator. So sometimes it's small changes like that can really add up over time. And I'm not just talking about days or weeks, but years. If you make these healthy habits, that can really help you long term.
Excellent. Dr. O'Connell, thanks so much for joining us today. And for more information on Men's Health Month, you can visit northernlighthealth.org. Well, when are we going to feel some relief from this heat and humidity? Kurt will let us know right after the break.